I've worked most well in the Great Southern, the goldfields, the wheat belt and Pilbara mostly. A little bit in the Kimberley, but not a lot. So, and it varies from places like Laverton to Ravensthorpe, down south, and to Jigalong and places like that. I enjoy the small towns. I only usually work in single doctor towns. Occasionally I do a little bit more than that, but mostly I work in single doctor towns.
I have kind of only been a bit selective with the locums that I've picked fairly large practices, except for that Kalgoorlie experience. Like, I've only still been in regional towns, even though Kununurra is considered rural. It still has a hospital, it still has visiting specialists, the clinic has 4 other doctors at it. It's still been fairly similar to my experiences in Melbourne.
I'm at a stage in my career where I don't have to work, so but having been in the country myself, I think it's really nice to be able to get a locum who will come along and you can hopefully have confidence in, and they'll run your practice reasonably for the week or 2 or 3 you might want to have off. So I think it's a good service that we can provide and I think it keeps country doctors in their practice and in their towns for longer, because they are isolated, they've got to work hard, it's 7 days a week, and it can be all hours of the day and night. So it's really good, I think, for them to be able to get access to some sort of relief work. And so I think it's a valuable thing to do.
I guess horses for courses. I'm glad we're different. There's different jobs out there, but so far I've managed to get jobs that I feel supported in. The AMS was super different. Like, I'm from Victoria. We don't have many Indigenous patients. I just didn't have much exposure to that. And I wanted to, but I felt I couldn't just take an AMS job with no experience. But that just didn't feel fair to the community that I was going to totally stuff up with. So at least in Kununurra, again, it was a big clinic. There were 4 other doctors. I'd already been in the town, so I knew at least referral services and that kind of thing. It wasn't as big a step, so I felt like I could learn or have some exposure, but not be completely in the deep end with no idea. So it was a good little stepping stone to that. And I think I'd like to do more Indigenous health stuff in the future.
I think if you go to the small country town, I feel morally obliged to cover the hospital, but obviously you've got to be wax registered for that. And you do need to have some basic ED skills. But it's not exceptional stuff. I mean, you need to, do ECGs and suturing and dressings and lots of small things like ear syringing, which most GPs are actually capable of. And other things come in, whether it's heart attacks or strokes or whatever, and sometimes, orthopedic stuff, which is beyond your capability, but then you just have to refer them on.
But I guess there are things. You want a patient to have an MRI and they're going to have to fly to Perth, or there is stuff that you do need to think about whether that actually needs to happen, whereas in Melbourne they would have get an appointment tomorrow, 2 k's down the road. But it does change a little bit about more investigating and referring things and trying to deal with more yourself. So much of it's what's reasonable and what makes logical sense, and life coaching and actual statistics and doses and things is such a small part of what you do. But the hard thing is with locuming, it's the logistics and the who do you refer to, who costs the least, who will see them the soonest. Like, that stuff that varies everywhere is often the stuff that patients want to know, so that's, the medicine's fine, that's the same. It's all the referrals and the where to get stuff done, how, that's the hard bit. But again, that's why I like being at bigger clinics, because I can ask other doctors.
I personally enjoy the breadth of work because of working in the ED, and it's a bit different sometimes than the general practice surgery. So, it's always rewarding when you diagnose a patient and treat them well and they get better. And you feel like you've done your job well, and the patient's happy. People are very grateful in the country. They often thank you for coming, and it's so nice to have a doctor giving their doctor a break, and they often sometimes like, oh, it's nice to have a second opinion, you know, in the situation where they've only got one doctor within Koori, you know, of their town, and so somebody else comes along and they say, oh, that's really good, that's what our doctor says. I don't think it's frightening at all. I think it's just what we've all been trained to do.
But just everything has been so easy with accommodations and transports and everything, and so flexible. I don't know, like, I keep saying things kind of like half-heartedly, like, wouldn't it be cool if I could spend a week in Perth, or I don't want to catch a red eye, I will pay for the hotel in Darwin to get me on a normal flight, and you guys are always just like, no, that's fine. No, we'll sort that. No, fine. I'm like, oh, really?